celebrations. And let's turn our attention to health matters as the Lagos State government has activated a public health emergency operations center at a mainland hospital in Yaba following the recent outbreak of cholera. The Emergency Operations Center is expected to address the increase in number of severe cases across multiple local government areas in the state. Lagos State now has 350 suspected cases of cholera in 29 wards across multiple local governments with 17 confirmed cases. The Lagos State Commissioner for Health, Professor Akin, Abayomi, disclosed that although this is an increase from the numbers published 4 days ago, cases are now dramatically subsiding in previously affected local governments due to interventions and surveillance efforts. And Commissioner for Health, Professor Akin, Abayomi, joins us on the News at 10 to give us more updates on this development. It's good to have you join us on TVC News at 10.
Pleasure to be here.
Well, how dire is the situation we have on our hands, and have you been able to trace the source of this cholera outbreak?
So we first started to notice an increased number of severe gastroenteritis cases presenting to our public and general hospitals and PHCs about 7 days ago. We first had about 30 cases presenting mainly on the island and Lekki Peninsula. There were some narratives around a local beverage called Tiger Nut, which is popularly consumed around the island. The next day, we saw about 150 cases presenting across Lagos Island, Lekki, and the mainland. So that triggered us to realize that something was happening. So we activated our Emergency Operation Command Center, which is usually what we do when we suspect that there's an infectious problem going on the island, whether it's contact-borne or water-borne or airborne. So in this case, gastroenteritis, we expect it to be something like cholera at this time of the year. It comes periodically around the rainy seasons. And so we activated the center, and the center is made up of several pillars: a surveillance pillar, a laboratory pillar, case management, infection prevention, control, risk communication, point of entry, research, logistics, stakeholder management, and strategy and reporting. So once we swung into action, we were able to identify where these cases were presenting. We were able to obtain samples, take those to both our public health laboratories from the state and federal government that are based in Lagos, and then start a public awareness campaign. We soon got our results back, which confirmed that we're actually dealing with cholera, and it's a subtype that is known to be pretty aggressive and fairly contagious. So we started to activate our rapid response teams, district notification surveillance officers, and point case management, contact tracing. And after I think it was on the 14th when we had the highest number, we started to see subsequently a decline in the cases because of the active case finding and treatment.
Commissioner, we see what you're doing as a ministry to ensure that we get low numbers or low infections and we curtail the spread of the cholera. Now, but what treatment options really are available for those affected by cholera, and what is the current status, of the healthcare facilities or personnel handling this outbreak? Because, like you rightly said, that we already have a center activated in Yaba.
So the center in Yaba is just is ground zero for us. That's where the strategy and planning takes place. But we receive patients in all our facilities across the state, all our PHCs and all our general hospitals. And of course, we go to the private sector as well. So it's important that we include the private sector as well as complementary alternative medicine practitioners, of which we have a large number in Lagos. And so our strategy involves information dissemination across the cadres of healthcare provision in the state. For us, it's important that we give information to the public that you notice the early symptoms of cholera, which is a severe gastroenteritis, which is accompanied by profuse diarrhea and quite often vomiting as well, which is why patients come down so quickly. Like with all diseases, you have a spectrum of severity. Some people will have cholera and just have a mild illness. Others will have cholera and, will have a bit of diarrhea and vomiting or just diarrhea. Then others will have very, very profuse diarrhea with intractable vomiting. And these are the people that really come down very quickly with dehydration. So we set up care centers across all our public facilities. Those that are very severe, some are just treated with oral rehydration and sent back home with advice. And then we monitor what's happening in the home. Those that can be admitted at our primary healthcare facilities and general hospitals for a day or two are treated with IV fluids and sometimes antibiotics and then sent home. Those that get very sick, we transfer them to infectious disease hospital in Yaba, where we have advanced expertise there and the ability to resuscitate people and even use things like renal dialysis to rescue people whose kidneys have shut down because of the severe dehydration. But important in the community to give information that when you notice the early symptoms of cholera, which is abdominal pain, bit of fever, diarrhea, vomiting, that you come quickly, because it's only when you come quickly and in between you coming to the hospital, you should start oral rehydration therapy if you're not vomiting. But the sooner you present, the earlier we can treat you.
Professor, I would like to just hold you a bit while we go on this short break, and then we'll continue this conversation. Just stay with us on TVC News.
Our planet, our home, threatened by man's activities with fears of mass extinction on the rise. On Green Angle, we examine the issues that affect our environment, seek solutions to put us on track to secure and restore a cleaner and greener world for generations to come.
You're watching TVC News at 10, and we are talking about the cholera outbreak in Lagos, where we have already 15 persons confirmed dead by the Lagos State Ministry of Health. And we have the Commissioner, Professor Akin Abayomi, with us explaining how we should fight this together as a community. Professor, talk to us about what symptoms we should be looking out for as citizens and how we can treat this disease.
Early symptoms of cholera, you feel unwell, you have abdominal pain and cramps, you start to develop diarrhea, it becomes repeated and frequent. You may or may not have vomiting, you quite often do. Some people have a fever. And once you notice these symptoms, the first thing to do is to start oral rehydration therapy. This is available at most pharmacies, at every pharmacy across the state. If not, you can quickly Google it and make it yourself at home with clean water, a little bit of sugar and a little bit of salt. This helps your intestines absorb the water that you're losing from the diarrhea and from the vomiting. But as soon as you notice these symptoms, you need to reach out for help. You need to go to your nearest public health facility, your primary healthcare facilities, your general hospitals, or a private hospital near you, anybody that can give you first-hand treatment. In the public sector, when we're dealing with a public health emergency, treatment is free. Once you're a suspected case of cholera, the government carries the bill. It's in our interest to bring people into hospital to stop the chain of transmission. So because of all these activities, once we activate an emergency operation command, then a lot of action gets deployed. And what we soon see, is the number of cases start to decline. And what we've seen now is that in the past 4 days, the numbers have been going down steadily. In fact, it's gone down from 140. The next day was about 70, down to 50, 40, 30, and yesterday we had 10.
So we have nothing to worry about.
Well, I'm not saying we don't have anything to worry about because we're in the festive season now. So there's a lot of public gathering. There's a lot of catering and cooking and eating, lots of contact between people. So we don't want, that's why we've been so aggressive to activate the command center. We want to make sure that we can have a festive season without recourse to people getting sick and a pandemic or an outbreak on our hands. So we still have to remain on high alert that the public are aware of precautions, safety, hygiene, use of good, clean water to consume, keep your hands and the environment clean, and make sure, just like COVID, that you avoid very crowded places and you avoid too much contact and keep your hands washed regularly, sanitized, and keep a slight distance between yourselves and watch out what you eat. And watch out what you drink.
A very important point at this season. Thank you so much, Commissioner for Health, Professor Akin Abayomi, for speaking with us.